Pharmacokinetic. The second lecture will talk about the kinetic of a drug in the body. Let's first go to a definition. What is pharmacokinetic? It refers to what the body does to a drug, whereas pharmacodynamic describes what the drug does to the body. That means the drug when enter inside the body, there's a limitations there, like such as there's an enzyme, there's a method of absorption. The drugs need to be absorbed, the drugs need to be distributed and then metabolized by a certain enzymes and hormones, or excretion. These factors, all of these factors is referred to the rate limiting step to the kinetic. Four pharmacokinetic properties determine the onset of action, intensity, and the duration of drug action actually. First, absorption, the most important and first important step. First, absorption from the site of administration permit entry of the drug either directly or indirectly into the plasma. Second, after the absorption, the drug should be distributed. Second, the drug may then reversibly leave the bloodstream and distribute into the interstitial and intracellular fluid. Three, metabolism. Third, the drug may be biotransformed by metabolism by the liver or other tissues. Sometimes the drug by metabolism transformed to something more active than the parent drug, and sometimes the activity of the drug terminated when it metabolized or got the metabolism. For elimination, very important, finally the drug and its metabolites are eliminated from the body in urine, bile, or feces. Using knowledge of pharmacokinetic parameters, the clinician can design optimal drug regimen. That means when you understand and when you study the absorption, the distribution, the metabolism, the elimination, you can design the regimen of drugs and the route of administration, the dose, the frequency and duration of treatment. What does frequency mean? It means how many times in the day the drug should be administered. It depends on T-half, and the T-half depends on what? Depends on the volume of distribution and on clearance. All these points will be studied in this lecture and the lecture of tomorrow, inshallah. Well, let's go to this slide, which is talking about the routes of drug administration. The route of administration is determined by the property of the drug. For example, water or lipid-soluble ionization. Second factor, which is determine the route of distribution, is the therapeutic objectives. For example, the desirability of rapid onset. Like for example, if you want the drug act immediately, at that time I think the injection is the most important one. What type of injection? Definitely it's gonna be intravenous, because here the bioavailability is 100% and the activity, definitely the onset of action is much more rapid than when you give it as an oral route. So what is the desirability of the treatment? If you want rapid onset, the need for long-term treatments or restriction of delivery to local site. Like for example, you want your drugs only locally at the site of action. At that time, you need to inject it with another compound, need more ionization, so that the drug not be distributed to other parts of the body. So here the route of drug administration determined by property of the drug again and the therapeutic objectives. Now, internal administration. Administering a drug by mouth is, what is the advantages now for drugs which is given by mouth? Well, it is safest than other route, because in other route like in IV or intramuscular there is a chance of inflammation or chance of entrance of bacteria at the site of injection, while in mouth no such risk. So it is safe, common, convenient. That means the patients is prefer it rather, and all the patients or maybe the majority don't like injections, and moreover economical. So it's cheaper than others. So it's the safest, common, convenient, economical. Methods of drug administration. The drug may be swallowed, allowing oral delivery, or it may be placed under the tongue, called sublingual, or also between the gums and cheek, called buccal, facilitate direct absorption into the blood stream. This is the method of administration for the oral. So it's either swallowed in case of solid and liquid, sublingual, and buccal, and facilitating drug absorption into the bloodstream. Oral administration provides many advantages. Oral drugs are easily self-administered. Toxicities and or overdose of oral drugs may be overcome with antidotes such as activated charcoal. However, the pathway involved in oral drug absorption are the most complicated, and the low gastric pH inactivates some drugs. That's why, my students, I want all of you concentrating here. The oral one, when any toxicity occurred for drugs being consumed orally, it's easier to give antidote to this toxicity in comparison to the injection. We have here a wide range of oral preparations available, including the enteric-coated extended release preparation. Now, what does this mean? Enteric-coated preparation. An enteric coating is a chemical envelope that protects the drug from stomach acid. That means خلينا نقول نحكيها بالعامية، الحباية تكون مغلفة بغشاء يحميها من حامضية المعدة، لأنه لو لم يكن هذا الانترك كوتد عليها وبلع المريض الحبة، فحامضية المعدة تؤدي إلى تلف الدواء، وبالتالي لا يصل من الدواء شيء أو يصل النزر اليسير، فبالتالي ما يحقق الفائدة العلاجية له. لذلك شباب لازم تنتبهون أنه هناك بعض الأدوية المكتوب عليها انترك كوتد، فول كوتد، إلى آخره من الكوتنج عدا الشوجر كوتنج. ننتبه أنه هذه الأدوية cannot be crushed. يعني إذا الطبيب قال لك اقسمها بالنص، قل له اصبر حبيبي، لا يجوز أن نقسمها بالنص، لأنه أنت هنا تتعرض الدواء إلى حامضية المعدة، وإلا ما كان سووها enteric coated. Delivering it, this enteric coating, delivering it instead to the less acidic intestine. When the coating dissolves and release the drugs. يعني بعد أن تبقى بالمعدة عادة نص ساعة إلى ساعة، the stomach push its content into first part of the intestinal, which is the duodenum. At the duodenum there is a lot of microvilli which offer a very wide surface area. At that place the acidity is less. Then this shield, this envelope, greatly affected by the basic or less acidic environments, it will be opened up and the drugs releases there, and the absorption occurs at the intestine. Enteric coating is useful for certain drugs, for example omeprazole, that are acid unstable, drugs that are irritating to the stomach such as aspirin. can be formulated with an enteric coating that only dissolves in the small intestine, thereby protecting the stomach. The other dosage form is the extended release preparation. Extended release, abbreviated as ER or XR, medications have special coating or ingredients that control the drug release, thereby allowing for slower absorption and a prolonged duration of action. That means its release is slow and its activity take long time. So it's very appropriate for those patients who doesn't like to take more than one tablet or one capsule in the day. At that time, they prefer to take such formula because they are taking once daily. The extended formulation can be dosed less frequently and may improve patients' compliance. Additionally, extended release formulation may maintain concentration within the therapeutic range over a long period of time as opposed to immediate release dosage form, which may result in large peaks and flow in plasma concentration. Well, and troughs in plasma concentration, that means it is sustainedly the blood plasma contains the drug in a stable manner in comparison to other type of dosage form. So the extended release formulation are advantageous for a drug with short half-life. For example, the half-life of oral morphine is 2 to 4 hours, and it must be administered 6 times daily to provide continuous pain relief. However, only 2 doses are needed when extended release tablets are used. Sublingual or buccal. Sublingual كلكم سامعين بالحب اللي تحت اللسان أو الحب اللي ينوضع بين أو على اللثة بين اللثة وبين الخد من داخل الفم. Placement under the tongue allows the drug to diffuse into the capillary network and enter the systemic circulation directly. Sublingual administration has several advantages, include ease of administration, rapid absorption, bypass of harsh gastrointestinal GI information, and avoidance of first-pass metabolism. The buccal route between the cheek and gum is similar to the sublingual route in advantages. Well, after internal, the parental now. Parental is another part of route of introduced drug directly into the systemic circulation. Parental administration is used for drugs that are first poorly absorbed from the GI tract. For example, heparin. Unstable in GI tract, that means the GIT lead to distract the drug itself. For example, insulin. That's why insulin, you cannot find tab called insulin. Patients is unstable to take oral medications like an unconscious patient. يعني البيشنت فاقد للوعي، فشلون أخي يبلع الحباية؟ ما عنده حل ثاني إلا أنه يأخذها عن طريق البارنترال. Circumstances that require rapid onset of action. عندنا حالات طارئة، مو مال إنه ننطي الحباية وننتظر ساعة أو 3/4 ساعة حتى ينطي الفعالية مالته، فلذلك نحتاج نعطيه parenteral. In addition, parenteral routes have the highest bioavailability and are not subject to first-pass metabolism or the hard GI environments. Parenteral administration provides the most control over the actual dose of a drug delivered to the body. However, these routes of administration are irreversible and may cause pain, fear, local tissue damage, and infections. The 3 major parenteral routes are intravascular, intravenous or intraarterial, intramuscular, and subcutaneous. Let's first go through intravenous. In intravenous, injection is the most common parenteral route. It's useful for, first, drugs that are not absorbed orally, such as the neuromuscular blocker, for example, rocuronium, and permit rapid effect and maximum degree of control over the amounts of drug delivered when injected as a bolus. What does bolus mean? يعني ندفع الدراجز كاملا. The full amount of drug is delivered into the systemic circulation almost immediately. If administered as an IV infusion, the drug is infused over a longer period of time, resulting in lower peak plasma concentration and an increased duration of circulating drug levels. IV administered is advantageous for drugs that cause irritation when administered via other routes because the substance is rapidly diluted by the blood. That means there is no an irritation. Unlike drugs given orally, those that are injected cannot be recalled by strategy such as binding to activated charcoal. يعني إذا صارت السمية بالاي في واحنا ناطين الدواء اي في مو مثل لما نعطيه اورال تتذكرون قلنا نعطيه activated charcoal as an antidote. هنا ما ممكن، هاي الوسيلة غير ممكنة على اعتبار انه رأسا راح بالبلاد circulation. IV injection may be accident introduce infectious or infections through contamination at the site of injection. It may also precipitate blood constituent induce hemolysis or cause other adverse reaction if the medication is delivered too rapidly and high concentrations are reached too quickly. Therefore, patients must be carefully monitored for drug reaction and the rate of infusion must be carefully controlled. Now, after we learned about the IV, let's go to the intramuscular. Drug administered IM can be first in aqueous solution, which are absorbed rapidly, in specialized depot preparation, which are absorbed slowly. Depot preparation لما تقرأ على الدواء depot often consists of a suspension of the drug in a non-aqueous vehicle such as polyethylene glycol. As the vehicle diffuses out of the muscle, the drug precipitates at the site of injection. The drug then dissolves slowly, providing a sustained dose over an extended period of time. Example of sustained release drug is haloperidol. Now, subcutaneous, like intramuscular injection, subcutaneous injection provides absorption via simple diffusion and is slower than the IV route. Subcut injection minimizes the risk of hemolysis or thrombosis associated with the IV injection and may provide constant, slow, and sustained effect. Maybe this is considered as an advantageous for the subcut over the IV. This route should not be used with a drug that causes tissue irritation because severe pain and necrosis may occur. Drugs commonly administered via the subcut route include insulin and heparin. Route of administration C, and we call it other, is the oral inhalation. Inhalation route, both orally and nasally, provide rapidly delivered of a drug across the large surface area of the mucous membrane of the respiratory tract and pulmonary epithelium. Drug effects are almost as rapid as those with IV bolus. Drugs that are gases, for example, some anesthetics, and those that can be dispersed in an aerosols are administered via inhalation. This route is effective and convenient for patients with respiratory disorders such as asthma or chronic obstructive pulmonary disease because the drug is delivered directly to the site of action, thereby minimizing systemic side effects. Examples of drugs administered via inhalation include bronchodilators such as albuterol and corticosteroids such as fluticasone. اللي هي البخاخات شباب. Second one of inhalation is the nasal. This route involves administration of drug directly to the nose. Example of agents include nasal decongestants such as oxymetazoline and corticosteroids such as mometazone furoate. Desmopressin is administered also intranasally in the treatment of diabetes insipidus. 3. Intrathecal, intraventricular. The blood-brain barrier typically delays or prevents the absorption of drugs into the central nervous system. When local rapid effects are needed, it's necessary to introduce drugs directly into the CSF or cerebral spinal fluid. For example, intrathecal amphotericin B, which is antifungal, is used to treating cryptococcal meningitis. يعني السحايا اللي سببها طبعا فطريات. هنا ننطي بالانتراثيكالي. Now the other route is the topical. Topical application is used when a local effect of the drug is desired. For example, clotrimazole is a cream applied directly to the skin for the treatment of fungal infection. Transdermal, this route of administration achieves systemic effect by application of the drug to the skin, usually via transdermal patch. The rate of absorption can vary markedly depending on the physical characteristics of the skin at the site of application, the lipid solubility of the drug. This route is most often used for the sustained delivery of drugs such as the anti-anginal drug, nitroglycerin. يعني عندنا باتش لزقة بنسميها، الدواء من ينحط على المكان هذا ينزل الدواء بشكل بطيء وبشكل منتظم، فيسموه sustained release مثل الانتي انجينال. الباتش اللي عندنا نيتروجليسيرين، انتي اميتيك سكوبولامين، نيكوتين ترانسديرمال باتش. هذا يستعملوها اللي يريدون يقطعون التدخين، ينطوه باتش بنيكوتين لكن هو نيكوتين مصنع structurally related للنيكوتين which is used to facilitate smoke cessation. Route of administration number 6 is the rectal. Because 50% of the drainage of the rectal region bypasses the portal circulation, the biotransformation of drug by the liver is minimized with rectal administration. يعني الأدوية اللي يتم عملية الميتابوليزم مالتها بالليفر هنا وبسرعة بحيث انه نسوي لها دي اكتيفيشن، هنا نقدر نستعملها rectally، فبالتالي ما تمر للريفر. The rectal route has the additional advantage of preventing destruction of the drug in the GIT environment. This route is also useful if the drug induces vomiting when given orally, if the patient is already vomiting or if the patient is unconscious. Rectal absorption is often erratic and incomplete and many drugs irritate the rectal mucosa. هذا طبعا هو disadvantage مالته. Well, now let's go to the first part of kinetic, which is the absorption of drug. Mechanism of absorption of drug from GI tract عندنا عدة طرق. الأولى هي الباسيف diffusion. The deriving force for passive absorption of a drug is the concentration gradient across a membrane separating two body compartments. بمختصر يعني يجي من التركيز العالي إلى التركيز الواطي. هذا نسميه passive diffusion which does not involve هاي البروسيس ما بيها carrier not saturable. يعني ما احتاج كارير حتى اجيب الدواء لان هو يجي من وحده يدخل من يصير له absorption من المنطقة العالية الى المنطقة الما بيها. not saturable ما راح يصير عملية saturation، راح يستمر الى ان يخلص كل الدواء يصير له absorption. shows a low structural specificity، ايضا كله يدخل بدون specificity. هذا الكاركترستكس مالته مال الباسيف diffusion. The vast majority of drugs are absorbed by this mechanism. Water-soluble drugs penetrate the cell membrane through aqueous channels or pores, where lipid-soluble drugs readily move across most biologic membrane due to their solubility in the membrane lipid bilayers. Other method now facilitated diffusion. Other agents can enter the cell through specialized transmembrane carrier proteins that facilitate the passage of large molecules. This carrier protein undergo conformational changes allowing the passage of drug or endogenous molecules into the interior of the cells and move them from an area of high concentration to an area of low concentration. Here in this process, the facilitated one not required energy, it does not required energy, can be saturated. ليش؟ لأنه إذا خلص الكارير فما يمكن بعد ما يقدر يدخل فيصير saturation may be inhibited by compounds that compete for the carrier. هذه الثلاث نقاط هي الكاركترستكس مال هاي البروسيس facilitated diffusion. Active transport. This mode of drug entry also involves specific carrier protein that span the membrane. A few drugs that closely resemble the structure of naturally occurring metabolites are actively transported across cell membrane using specific carrier protein. Here, energy-dependent active transport is driven by the hydrolysis of adenosine triphosphate. It is capable of moving drug against the concentration gradient from region of low drug concentration to one of high drug concentration. The process is saturable. Active transport systems are selective and may be competitively inhibited by other co-transporter substances. طلاب أريدكم تسوون مقارنة بين هاي الطرق الثلاثة اللي هي الباسيف والأكتيف والفاسيليتيتد. The other method of administration here are the endocytosis and exocytosis. This type of absorption is used to transport drugs of exceptionally large size across the cell membrane. Endocytosis involves engulfment of drugs by the cell membrane and transport into the cell by pinching of the drug-filled vessels. Exocytosis is the reverse endocytosis. العكس بالضبط مال الاندوسايتوسيس. Many cells use exocytosis to secrete substances out of the cell through a similar process of vessel formation. Vitamin B12 is transported across the gut wall by endocytosis, whereas certain neurotransmitters, for example norepinephrine, are stored in intracellular vessels in the nerve terminal are released by exocytosis. Now, what is the factor influencing absorption? First, pH of drug absorption. Most drugs are either weak acid or weak base. Acidic drug release proton causing charged anion to form. Weak base can also release an H proton. However, the protonated form of basic drug is usually charged and loss of a proton produce the uncharged base. مختصر طلاب كل الدراجز اللي تتحول يعني ذا ويك اسيد تحط له اسيد تحطه بمكان بي اسيد هنا شو اتوقع ايونايزيشن لو نوت ايونايزيشن نوت ايونايز اذا اسيد ويا اسيد فبالتالي شو يصير ابزوربشن اما اذا صار ايونايز فيكون نوت ابزوربد اذا الكompound which is unionized can be passed easily and absorbed and the one which is ionized cannot. Second, blood flow to the absorption site. The intestine receives much more blood flow than the stomach, so absorption from the intestine is favored over the stomach. 3. Total surface area available. إذا هاي كم فاكتور صار عندي البي اتش صار عندي البلاد فلو والتوتال سيرفيس اريا available for absorption with a surface rich In brush borders containing microvilli, the intestine has a surface area about 1,000-fold that of the stomach, making absorption of a drug across the intestine more efficient. Factor number 4, which is effect on absorption process, is the contact time at the absorption surface. If the drug moves through the GI tract very quickly, as can happen with severe diarrhea, is not well absorbed. Conversely, anything that delays the transport of the drug from the stomach to the intestine delay the rate of absorption of drugs. يعني كل ما كان الكونتاكت تايم مدة أطول يكون الابزوربشن أكثر. Expression of paraglycoprotein. هذا is a transmembrane transporter protein responsible for the transporting various molecules including drugs cross cell membrane. It expressed in tissue throughout the body including the liver, kidney, placenta, intestine, and brain capillaries, and is involved in transportation of drug from tissue to blood. هذا أيضا فاكتور رقم 5 وهو فاكتور مهم جدا. هسه وصلنا إلى الترم المهم بعد الابزوربشن اللي هو البايو افيلابيلتي، اللي هو الريت and extent to which an administered drug reaches the systemic circulation. طلاب شوفوا، كلمة البايو افيلابيلتي تعني سرعة ودرجة وصول كمية الدراج ايش قد من الدواء إلى السيستميك circulation. For example، إذا عندنا 100 ملغ من دواء administered orally، 70 ملغ is absorbed unchanged. إذا البايو افيلابيلتي مالته ايش قد 0.7 لأن 70% يعني. Determination of bioavailability is important for calculating drug dosage for a non-IV route of administration. ليش؟ لأن ال IV route 100% البايوافيلابيلتي مالته. بشكل عام طلاب determination of bioavailability by comparing plasma level of a drug after particular route of administration. For example, oral administration with level achieved by IV administration. IV administration 100% of the drug rapidly enter the circulation. When the drug is given orally, only part of the administered dose appears in the plasma. By plotting the plasma concentration of a drug versus time, the area under the curve can be measured. The total area under the curve reflects the extent of absorption of the drug. يعني الاريا under the curve هنا شنو هي طلاب؟ هي البايو availability. Bioavailability of a drug given orally is the ratio of the bioavailability or AUC following يعني area under the curve following oral administration of the to the AUC following IV. يعني الاريا under the curve مال الاورال على الاريا under the curve مال IV, assuming IV and oral dose are equivalent. Now, what is the factor that influence bioavailability? First pass hepatic metabolism. When a drug is absorbed from GI tract, it enters the portal circulation before entering the systemic circulation. If the drug is rapidly metabolized in the liver or gut wall during this initial passage, the amount of unchanged drug entering the systemic circulation is decreased. This is referred to a first pass metabolism. For example, more than 90% of nitroglycerin is cleared during first pass metabolism. لهذا طلاب النيتروجليسرين قلنا ننطيه سبلنجوال حتى نتخلص من الميتابوليزم وبالتالي تكون البايو افيلابيلتي مالته اعلى. The second factor was solubility of the drug. Very hydrophilic drugs are poorly absorbed because of their inability to cross lipid-rich cell membrane. Paradoxically, drugs that are extremely lipophilic are also poorly absorbed because they are totally insoluble in aqueous body fluids and therefore cannot gain access to the surfaces of the cells. For a drug to be readily absorbed, it must be largely lipophilic, yet have some solubility in aqueous solutions. C. Chemical instability. Some drugs such as penicillin G are unstable in the pH of the gastric content, فبالتالي يأثر كعامل مؤثر كبير. Others such as insulin are destroyed in GI tracts by degradation enzymes. D. Nature of the drug formulation. Drug absorption may be altered by factors unrelated to the chemistry of the drug. For example, particle size, salt form, crystal polymorphism, enteric coating, the presence of excipients such as binder and dispersing agents can influence the ease of dissolution and therefore alter the rate of absorption. هاي الفاكتورز جدا جدا مهمة طلاب، لأن هي من عندها احنا نقدر نغير حتى نزيد الابزوربشن ونزيد البايو افيلابيلتي. بهذا السلايد طلاب عندنا تيرم جدا مهم اللي هو البايو ايكويفالنس، اللي هي two drugs formulation are bioequivalent if they show comparable bioavailability and similar times to achieve peak blood concentration. يعني طلاب bioequivalency هي مقارنة البايوافيلابيلتي لدواء واحد يعني دواء من شركتين خلينا نقول، واحد مثلا شركة أصلية والآخر شركة غير أصلية، واحد براند واحد جينيريك لكن هو نفس الدواء. تقارن البايو افيلابيلتي مال هذا على هذا، وهذه تسمى عملية البايو equivalency. therapeutic equivalency اللي هو two drug formulation are therapeutically equivalent if they are pharmaceutically equivalent, that is they have the same dosage form, contains the same active ingredient and use the same route of administration with similar clinical and safety profile. هذا هو therapeutic equivalency. Note, clinical effectiveness often depends on both the maximum serum drug concentration and the time required after administration to reach peak concentration. Therefore, two drugs that are bioequivalent may not be therapeutically equivalent. If any questions, I'm ready to receive now. Thank you.